I'm Olivia Nyarko Mensah. I am presenting on partners in the suffering. African male spouses' stories and experiences living with obstetric fistula women at the International Continence Society Conference 2021. In this research update, we'll be looking at the background purpose, methodology, data analysis, findings, conclusions, and we'll have our references. In our current world, male involvement in maternal health issues such as obstetric fistula is currently making the headlines gradually in the global view. The increasing advocacy role to eradicate obstetric fistula worldwide has identified the need to involve the male partners as part of the interventional efforts put in place. For more than 3 decades, the obstetric fistula condition is labeled as a silent killer, a stark canker, and an epidemic in the sub-Saharan Africa. According to WHO, an estimated 2 to 3 million women and girls are living with the condition. And in the sub-Saharan Africa, between 50,000 and 100,000 women and girls are diagnosed yearly of the obstetric fistula condition. In Ghana, the Ghana Health Service also report that about 700 new cases are reported annually. The male partners in their quest to support their spouses and partners have varied experiences and stories to share. And this will help unveil the real nightmare world these male partners are going through. There are lack of information and evidence on the male partners as compared to their female counterparts who are going through the ordeal. Most researchers have focused on the female stories and experiences and living out that of their partners and spouses in the journey. The identified gap in literature has necessitated the need to listen to the stories of the male partners who are living with the women suffering from obstetric fistula. It is in this light that the study sought to understand the in-depth experiences and stories of male partners who are living with women with obstetric fistula. With our methodology, we utilized the qualitative approach and incorporated the narrative inquiry in a tertiary hospital situated in the Kumasi metropolis, Ghana. We used the purposive sampling technique to pick up 5 males between the month of August to October 2019. They were in the age range of 32 to 60 and face-to-face interviews were conducted. The data collected was finally analyzed using the narrative content analysis. 3 overarching themes emerged from the participants' stories, and it includes psychosocial and emotional torture and reality. The second one was on deprivation and changes with sexual life. And the third one looked at the divorce is an option if resilience to support fails. Picking the teams one after the other, Team 1 focusing on psychosocial and emotional torture and reality was incongruent with Tembo et al. 2020. Participant 2 sharing his experience said that, I must say that with all the years of experience in living with a woman with a leakage of urine, it's never been easy at all. It's been a real hassle because sometimes it looks like a mystery to me, watching my woman leaks to that extent. Yet, that is the reality on the ground. In fact, the experience is more than a mental torture and is full of household responsibilities, taking care of the sick wife, the children, and struggle to get some monies for the house. And also ensuring that all matters surrounding the experience is kept in private. I tell you, it's never an easy task at all. Sometimes I have to lie about what is happening when I am questioned as to why I am always doing the house chores. Another participant lamented that the reality is that I am talking about a woman who was very beautiful, and whenever she undressed in my presence, I felt satisfied with her. But honestly, as it stands now, I am dying within because I feel bothered about every surrounding her, everything surrounding her. But I wouldn't like her to also know what I am going through to compound with her stress. I thought I'll be enjoying my marriage with my pension baby and my then beautiful wife. But it's rather unfortunate. It did not turn out the way I anticipated or planned for. Tell me, what will you do if you are in the situation I am now? What will be your thoughts in such a situation? Wouldn't it have been stressful for you? This is the lamenting aspect of a 60-year-old male partner. Another participant who is 39 years also shared his experience in terms of sexual intercourse and how it has affected their sexual life. The second team looked at the deprivation of changes with sexual life, and it was also incoherent with Mensah et al. 2011 cited in Temple et al. 2020. The 42-year-old man in the quest to sharing of his experience started crying. I am absolutely tired of this punishment in marriage. It's getting too difficult now because ever since my wife delivered and had the fistula condition, I've been without sexual intercourse for 2 solid years, and it's getting difficult. If I tried going close, she complains of lower abdominal pain and sometimes cry. The smell alone few minutes after bathing puts me off from having sex. Sometimes she asks me whether I feel for other women or feel for sex, but I could only answer her with another question. How do you see the situation? And we just leave it there. The third overarching team looked at the divorce as an option if resilience to support their partners fail. And almost all participants shared their ordeal with this very theme. The theme was incongruent with what Mensah et al. 2011 also came up in their findings. From participant 5, a 37-year-old, he said, I think I have done my best supporting my wife in this journey, but I am a man who needs a woman to satisfy me. I know she will testify that I've been supportive so much, going through extra mile and doing the things any man will do for a wife or for his woman. But if the condition persists, I have no option than to leave the marriage for another woman because I have no child. But in any case, I'll try my best. Our study concluded that African males partners are equally challenged, and they are overwhelmed with the various psychosocial and emotional struggles as their spouses live with obstetric fistula disease. Instead of succumbing to the pressures and being in the fists, they try their best to support their partners. This really helped them go through the ordeal together. It was therefore recommended from this study that policymakers could empower the male partners by allowing them first to share their stories to the world, so that it will help them identify various strategies that will help in supporting their spouses and also in focusing on eradicating the condition as it stands. The spouses can also help as key agents in the prevention, treatment, and reintegrating measures of the affected women into their communities again, so that the eradication process will be successful, especially in the sub-Saharan African countries. These are references, and thank you very much for your attention.